Hello, everybody. I'm joined today by Dr. Maggie Sopic. Maggie, do you want to introduce yourself?
Sure. Well, like you said, I'm Dr. Maggie Sopic. I own Recenter Chiropractic Wellness and Functional Medicine, and it's in Boalsburg, just right by the pump station in the Military Museum. But I'm also a certified chiropractor, and I also do functional medicine, which is just again looking a little bit more at the internal aspects of your health and looking at the full picture and not just the symptoms or not just one system. So that's a little bit about me.
Yeah. And you guys all know, hopefully by now, that I'm Dr. Emery Pitcel. I am the owner of Rothrock Chiropractic and Rehabilitation. We are in State College, right next to the Ramada Hotel. So I was really excited to actually get a podcast series going with Dr. Maggie here because she is pretty much the functional medicine guru. I know, as I say, I know enough about this stuff. I learned it in school. I know enough to talk competently to patients, but I don't really know as much to take clinically next level and be like, these are the decisions that should be made. So, because of Dr. Maggie's breadth and knowledge, I wanted to bring her on and have us work on a podcast together so that way we can better empower all of our patients, hers, mine, the whole State College, Center County community. So that way we can more holistically treat people. So that is, usually we don't start a podcast with like, what is our 30,000-foot view and hope of the goal of the
Yeah.
podcast? But that's what I'm hoping that we
Yeah.
can achieve with this here today. So,
Yeah. Thank you for having me. Yeah.
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 Exactly. That's the whole point.
So, on that note, welcome to Macros and Micros, which is macronutrients, micronutrients. As we said, I'm Dr. Emery Pitzel.
Maggie Sopic.
Yeah, doctor, right?
Yeah.
And it's February of 2025, so we're right in the heart of winter. So we figured, what better time to talk about, the lack of sunshine and issues that we could run
Mm-hmm.
into. So this was kind of like the perfect time to
Yeah.
point out vitamin D, right?
Yeah. Exactly.
Yeah. So those who haven't, I'm sure just about everybody's heard of vitamin D, but it's
Right.
nicknamed the sunshine vitamin. Kind of a quick biochemistry lecture. We're not going to go super deep into the well because neither you or I are biochemists.
Right.
But essentially, vitamin D is a fat soluble vitamin. Now, there's basically two major types of vitamins. You'll hear that there's fat soluble and you'll hear that there's water soluble. So the water soluble vitamins are the ones that you take into your system. They are basically, you could take them kind of any time of the day because they're going to be absorbed just about the same, just about any time of the day. And then if you take too much of it, basically it goes into your urine and you pee out anything extra that you take. So the chance of like overdoing it and running into like a toxicity issue, it could happen, but it's not very common, correct?
Mm-hmm. Right.
Versus vitamin D is under what we call one of the fat soluble vitamins. So therefore the suggestion with that is going to be to, if you're orally intaking your vitamin D, whether that's the drops or through your food, you're going to want to make sure that you have it with like a good hearty meal that has like some fat with it, because then that's going to be the best uptake by the body there. And then once it's in the body, vitamin D gets converted to basically an active type of steroid hormone, and it has a major impact on regulating calcium, phosphorus, and as a result, it's really important for bone mineralization,
Yeah.
which we'll get into that a little bit. Actually, how about right now? Because
Sure.
that's
Yeah.
almost like a perfect segue.
Yeah.
Tell us about the function of vitamin D in the
Yeah.
body. Like, once it gets in, like, what are kind of like all the organ systems and
Right.
pathways? Maybe not all of them, but what are some of the
Yeah.
most important ones that it starts to work
Right.
on?
And I won't get too far into the weeds, but and I think I may be jumping the gun a little bit. But I did want to talk about a deficiency because I think we can relate it a little bit more. So if we hear of like rickets in children or osteoporosis, osteomalacia, that is connected with vitamin D deficiency. So we can connect that with, oh, it's really helpful for our bones. So obviously it plays a huge role in that system. And then one that we may be a little bit more common to hear is our immune function.
Yes, absolutely.
So there are many, without getting into the weeds, but many systems and cells that are regulated and need vitamin D for that regulation. Um, And in that same aspect, some maybe not so commonly, I guess, or intuitively thought of, is with our immune system, we can think about maybe autoimmune conditions. So
Right.
when there's maybe a thyroid function, like hypothyroid Hashimoto's, even we can semi-relate it to like fibromyalgia, if we want to look into or get into that conversation of like autoimmunity and musculoskeletal care. So vitamin D is really, really awesome for that. Um, Obviously, the cardiovascular function, with it being fat soluble, we need a lot of great fats for that, and arterial function and structure.
Hmm.
And I guess a couple more here. Our nervous system, because again, it can be really helpful. And I don't want to get too far because I know I don't want to overlap too much, but really helpful for like anti-inflammatory and just overall conduction of our nerves to make sure they're functioning well.
Yeah,
Yeah.
absolutely. Well, and the reality is all these topics are going to bleed into each other. But I know one of the things that gets talked a lot about in medical schools and chiropractic schools, whatever type of healthcare provider you go into, is that you can't understand abnormal until you understand normal, right?
Right.
So the reality is as you're talking about normal a little bit, you're starting to tip off what the abnormal is going to be, right? They,
Right.
they they go lock hand, hand in hand as far as that's concerned. Definitely, those are a lot of the notes that I had as well too. Definitely huge on the immune function, and I mean,
Mm-hmm.
my goodness, we're right in the heart of February. We've had probably the coldest winter here in
Mm-hmm.
central Pennsylvania, so I'm told in at least a decade, or like the coldest
Yeah.
January.
Wow.
So who all hasn't heard about like you know little Susie has the cold, little Johnny has RSV, right? So just making sure that those vitamin D levels are the way that they're supposed to be to
Mm-hmm.
kind of help out with that immune function. Like you said, vitamin D is also anti-inflammatory, antioxidant, so it's just
Yeah.
huge even for some of the autoimmune conditions.
Yeah.
Um, Love that you discussed, muscle and nerve function. That's perfect. Did we make a little bit of note about with mood as well too, right?
Yeah, yes.
You want to
So,
take the
yeah,
lead on
thanks for
that?
bringing that up. But
Yes.
yeah, for overall, I mean, it can go hand in hand again with like the anti-inflammatory and with neuroinflammation. So, just nervous system again in our brain. And
Hmm.
so that can alter some of our chemical messengers with how we perceive different stressors and our mood and our mental state and emotions. So, it plays a huge role in that. Yeah.
Absolutely, absolutely. And then, like you said, you were just kind of rehashing what you said. You were already kind of tipping off things like the rickets and osteomalacia,
Mm-hmm.
osteoporosis. But I think usually when people think vitamin D, the number one thing that they probably go to in their minds is the bone health, right?
Mm-hmm.
So again, you need that proper levels of vitamin D, so you have that proper balance between calcium and phosphorus, which work antagonistic to each other, but that's
Mm-hmm.
going to be what supports proper bone and joint health.
Right.
So this is one of those exciting ones to start on for episode 1 because the overall breadth of vitamin D is massive.
Yeah.
There's almost not a single there almost isn't a single organ system that this doesn't
Right.
work on,
Right.
right?
Absolutely.
Yeah, yeah.
Yeah.
So again, we were getting into it a little bit, but how
Yeah.
about we jump into some of the tall tale deficiency
Yeah.
signs? You're gonna, as we kind of discussed, how about you take the lead on a little bit more of the internal health and internal
Yeah.
organ structures,
Yeah.
and then after Dr. Maggie's done talking about that, I'm actually going to show some of kind of like the false signs, like the things that we think like, oh, this is a chiropractic case, and then we get into it, it's like,
Right.
oh, this might be vitamin D, so we're referring over
Yeah.
to her to test. So
Yeah.
take the
Yeah.
lead on that,
Yeah.
please.
So some signs and symptoms will say fatigue is a huge one.
Yeah.
Depression actually, or just an altered like emotional state, just how we kind of just talked about.
Mhm.
And pain and discomfort is a big one. Cramping, some weakness, and some heart rhythm irregularities can also be a sign and symptom of vitamin D deficiency. Again, all of these things you want to talk to your practitioner about. And then, of course, there are some other like functions. Say again, if you do have, it may not be the actual cause of say like an immune problem, but it is associated with it. So we just want to make sure again. So I mentioned earlier, like the thyroid case. So we want to just make sure that we're having enough vitamin D for those pathways to make sure that our thyroid is working well. Another immune condition that is getting a little bit more of a little bit more talk, I guess, is POTS, which is postural orthostatic tachycardia.
Yes.
There's a lot of correlation with COVID. And so it's, again, not necessarily that vitamin D is causing it, but there is a big correlation, and it can be a huge game changer to make sure that we're getting enough vitamin D to, again, really support our whole system with that.
Yeah. As you were kind of talking through this,
Yeah.
I feel like this is a really strong bullet point because maybe people hear the term functional medicine and they
Mhm.
don't exactly understand what that means.
Yeah.
Like maybe they think like that's treating internal. I'm going to give you what I perceive my definition
Sure.
is, and then you tell me if I'm close or if I'm way
Yeah.
off the mark, right?
Yeah.
So for it, it's kind of like a compare and contrast, right?
Yeah.
So what medical doctors are insanely good at and where they are just absolutely working in their flame and what they're best at
Hmm.
is they're really good at diagnosis. So
Yeah.
they're really good at like nailing down what is the specific pathology in the body, and then from there they give fantastic solutions to get people back on their feet and get them back to stable. The
Hmm.
functional medicine approach is actually kind of taking a little more step back and saying like yes, that's important, but like let's see how we think that you might have this problem and actually just trying to look at more like globally the whole
Yes.
body,
Yep.
and then trying to say like okay, what things need to be tweaked to actually bring the whole body up instead of focusing in on like one specific area of pathology at a
Yeah.
time.
Yeah. You.
Is that about right?
Yeah. Absolutely. Yeah.
Yeah.
And I think too sometimes maybe I don't know, a discrepancy with understanding functional medicine is that it's only like natural measures, which as a
Hmm.
chiropractor I can't prescribe any medications or anything, but the goal is to be integrative and collaborate with people that are practitioners that maybe if this is necessary, maybe you do need to see this specialist and whatnot if appropriate. So yeah. Yeah.
Yeah, it's a line that I say all the time in here, and I know you and I have discussed this, and we both use the same line. It's
Hmm.
called time and place, right?
Yeah.
And as much as possible, everything in healthcare is like climbing a ladder. So you want to start with as much as possible your food being your medicine, your
Hmm.
supplements, natural lifestyle changes.
Hmm.
And then if that's not enough, then it's time and place to move up the rung and say,
Yeah.
like, okay, we're gonna go and let the medical doctors get
Hmm.
you like bumped up way up on your vitamin D. Hopefully that's just a short term plan to get you bumped
Right.
up, and then you go back down the ladder and work on the basics again.
Right.
But it's a process. It's not a destination,
Yeah,
right?
exactly. And those things we can do at the same time. Like if you are maybe
Absolutely.
seeing a specialist, there's a lot of lifestyle things that we can work on in the meantime as we're figuring things out too.
Precisely.
Yeah.
Love that.
Yeah.
Love that. So you did a pretty good job of covering deficiencies
Yeah.
in terms of internal health,
Yeah.
musculoskeletal. The number one things that we're going to see if somebody is really low on their vitamin D is we're going to see like bone and joint pain. And because calcium is such an important, and vitamin D regulates that intake and the blood levels of calcium, and calcium is so important for our muscle function. Somebody that's deficient in muscle in vitamin D might be coming to our office and saying like I've got these like sore muscles in my neck and everything. So this applies to all cases, but I don't say this to everybody. But when it comes up, I always say like our job basically is to try to treat just about everything that comes in. If we figure out it doesn't belong in our office, then it's our responsibility to point the person in the right direction and make the
Mhm.
referral. So any case that actually comes in here, I keep in the back of my mind the cardinal rule of 4 to 6 visits. Basically, like we're going to treat it like it's a musculoskeletal problem, four
Mhm.
to six visits. If we get to like that fifth, sixth visit and something just doesn't seem right, where it's like, I would have expected you to have 70% improvement in this mobility,
Mhm.
like 60% improvement in your pain, and you're still stuck at 10%,
Right.
then we start to maybe flag that and say, like, maybe this isn't a true bone muscle pain. This weakness that you have in here isn't because of a compressed pinched nerve. The fatigue that you're complaining about isn't, because of like some sort of tension headache that you're getting driven. You actually have something where you need to look into your internal health vitamin D might be one of the ones, and
Mhm.
I'm going to refer you to Dr. Maggie to get that work looked at. Or if we think it's really severe enough, it's like, you know what, let's send you back to your primary first, and
Right.
then see if we can bring her in on your team in time. But the reality is we got to be checked in and tuned in, and there's nothing wrong with trying to treat something for 4 to 6 visits. But if it's not behaving correctly, we got to
Mhm.
make the right referral at that
Yeah.
point. And then, yeah, like we kind of alluded to, if the deficiencies get bad enough, then we're going to start to see the thinning of bone, osteoporosis. It could get to the point of softening, osteomalacia.
Mhm.
If the neurological function gets impeded enough, we can have somebody like start to have more falls, which is really scary in our
Yeah.
geriatric population because then we
Yeah.
start fearing for broken hips. Physical function loss, high level of depression. If we refer to one of our mental health counselors and they're not getting the results that they need to see,
Mhm.
then the discussion becomes, hey, is it a vitamin D problem, right?
Right.
Um, yeah, so I think that kind of hit that pretty well too.
Yeah.
Do you mind talking just ever so briefly about toxicity then?
Right, yeah. And we were kind of talking about this before recording, but toxicity, it is rare because a lot of us are very deficient in vitamin D, especially around this time of year.
Hmm.
Um, but it is a thing because it is a fat soluble vitamin, so it can be stored a little bit more. um, and so the most common issue with toxicity is kidney stones because we have that's how we um, transport and metabolize vitamin D. So we there's potential for a loss of kidney function or kidney stones. And some like more acute symptoms would be like nausea, vomiting, all of the more so red flags.
Yeah, yeah. But you and I kind of pulled the statistics from
Right. Yeah. I
public
wanted you
health.
to talk about this.
20 to 40% of people in the United States are estimated to be vitamin D deficient. So,
Yeah.
although we want to talk about the importance of toxicity and it's out there, and
Yeah.
the reason why we bring it up is not to be scare tactics, but to
Right.
just say, hey, if you think you have this, you should just at least have your hand held a little bit through the process here. Like be talking to a functional medicine provider or have a good conversation with your primary
Yeah.
care because you can overdo it and create a whole basket of problems. And
Yes,
we
you
don't
can.
want that to ever
Right.
happen to anybody.
Right.
But the more likely thing is that we're deficient in
Yeah.
20 to 40%. And in reality, we're going to get into it in just a little bit why black and brown people have a little bit more vitamin D deficiency than Caucasian and people that are of white ethnicities.
Mm-hmm.
Um, but we'll get into that in just a little bit. But so, point being, definitely a lot more likely to be deficient than overdoing it and run
Right.
into a toxicity.
Right.
So speaking of toxicity
Yeah.
and deficiencies, how much are we supposed to get a day, Dr. Maggie?
Yeah, I'm gonna average it. So for most, we'll say like adolescent to adult people, around 600 to 800 IUs. That just means international unit. That's
Hmm.
what you'll
Hmm.
see. That is the recommended daily intake. And so it's kind of like, well, what does that mean? Like, what is that? What does that
Yeah, yeah,
mean?
yeah.
And so we typically, I mean, especially during this time of year, with the sun not being out as much, we do supplement. And so, and I'll backtrack this a little bit later on, but if you are supplementing, and again, talking to your practitioner, checking levels, 1,000 IUs is typically safe a day, but we'll dive into more solutions in a little bit. But that's the recommended daily intake.
Yeah, yeah. And then just a little toss on there
Yeah.
too, because there's more and more pediatricians, which I love that they're
Hmm.
recommending this. There's more pediatricians that are telling parents now that because breast milk doesn't have vitamin D, breast milk is so advantageous on so many levels, right?
Right.
Like a lot of immunoprotection and just like the bonding between mom and baby. And both you and I are Webster certified doctors, so
Hmm.
we have a passion for working with pregnancy and trying to work with
Yep.
kiddos a little bit. But more and more doctors are recommending that kids like under two get the like the drops that have the
Yep.
400 IU and one drop a day. Really don't think that don't get the false mindset of like, oh, I'm gonna get my kid more and that's gonna be better for them. Like, nope,
Yeah.
just stick at the 400.
Yeah.
Don't mess with it. One drop a day. Do it with breakfast. Be done with it.
Yeah.
We did that with both of our daughters, and guess the jury's still out how their neurological function ends up
Yeah.
being long run, but I'd like to hope that we did well by them as
Yeah,
far as that
yeah.
goes. So,
That's great.
all right, perfect. Now where to get vitamin D, right?
Mhm.
Um, as we already alluded to earlier in the podcast, the number one and the best source and the best bioavailability and absorption is actually the sun. Which, yeah, February 2025. Sorry, guys, even if you are outside on a sunny day, the sunniest days here in central Pennsylvania are probably also the coldest. So you're all bundled up in your hat and your gloves and your thick coat and everything.
Mhm.
So very little of that skin is getting exposed to the sun. Not to mention too that the angle of the sun is a lot further south in the sky, so we're not getting like that direct
Right.
access. Even if you did go out in a t-shirt and or do something crazy like a polar plunge without a shirt on or
Yes,
something.
yeah.
Um, but keep in mind, in case you're watching this in the summer, right? Sunshine is your best source. For people that probably have more fair skin, like Dr. Maggie, myself, you're looking at probably 5 to 30 minutes of direct sunlight.
Mhm.
Typically, like late morning, early afternoon is the best. We always have to weigh that with okay, the gains, the benefits of gaining enough vitamin D with the risk of UV damage, right?
Right.
So the nice thing is even a lot of these SPF, like what 50s and whatnot, like a lot of
Mhm.
the good UV that will help the skin stimulate to make vitamin D still gets through and still gets that process, even if you have a
Mhm.
pretty thick sunscreen on.
Yeah.
So that's the good news. And that's also my way of saying don't justify going out without sunscreen to be like,
Right.
I need to make vitamin D, so I need to go sunburn myself. That's the wrong mentality.
Yeah.
A little too risky, like risk reward, a little too much risk for skin cancer long term versus the gains of
Mhm.
the vitamin D there.
Right.
And so, but in reality, if somebody is, black or brown, right, you have more melanin in your skin. So you might need to like bump that number to more like 30 to 60 minutes, right?
Yep.
Food, the best kind of bioavailability foods, going back to what we said with it being a fat soluble vitamin, some of them are very fatty foods, not surprisingly. Like whole eggs have a lot of like that good cholesterol and that good fat in them.
Mhm.
Fatty fish is great. So, if you've been trying to justify to your spouse at home why we should eat more fish, this is one of the
Yeah.
reasons why. Seafoods again, and then mushrooms. I know not everybody's a big fan of mushrooms. We are, but
Mm.
it's a very good source of vitamin D that does at least halfway decently get absorbed by the body. And then the last one, which I think I'll let you kind of take this if
Sure.
you don't mind, Doc,
Yeah.
is uh, tell everybody out there maybe like what kind of supplementation and what supplements are kind of
Mhm.
good to do for this.
Yeah. So I like how you mentioned the drops because I even like those for adults because you can titrate it. Obviously, look at the expiration date and all that good stuff. Um but I'll touch on that in a little bit more, but I think, the main thing we want to know is we want to test this and not guess if we're, being in a session with you for a musculoskeletal case and we're still like not getting to where we want or our optimal level.
Mhm.
Um, so most of the testing that you'll see is like a blood serum test, and the most common one you'll see maybe where it says vitamin D is 25OH.
Mhm. Mhm.
And there actually are a couple different serum tests that you may find on your labs. The 25OH is the most common one, and it's a great resource to understand where you're at. And so the optimal range I like to see, and with the evidence too, is around like 50 to 100.
Yeah. Right.
I'm pretty picky about it, and I normally want it to be like 60 to 70, like around there. That is just where we find like the most optimal like health as far as like reducing that fatigue and reducing the risk of depression or again even like brain fog too, which I forgot to mention.
Yeah. And if I may, just to
Yeah.
sorry to interrupt for a split second, but we were talking before that number for the longest time, and I think
Oh
there's
yeah.
even still quite a few medical clinics that are still going by this normal as being acceptable was like 30 or 40.
Hmm.
But if you're telling people like, hey, you're actually going to feel a lot better and perform a lot better and be a lot better if you're closer to 60, then that 30 number is so woefully adequate, is it not?
Yes. Oh
Yeah,
my
yeah.
goodness. Yes. Yeah, it is alarming. I just had a few patients that their levels were like 30 and below, and I was like,
Yeah,
gasp, like,
yeah.
all right, we gotta, yeah, there's something going on. And that's another thing I wanted to touch on is, all right, say you do have a low level, and maybe it is appropriate to do some, supplementation. And I do normally like the vitamin D3 with K2. I won't get into
Mm,
the weeds about that. But it's really dependent on what your level is. So it's not a fun answer, but it depends on your symptoms
but it's the
and on
truthful
the,
answer.
yeah,
It's always going to
yeah,
depend. Yeah.
right. So there may be a loading dose where it's decently higher per week, or it could be that maybe you just want to make sure we're getting those 1,000 IUs a day. For retesting, because we've mentioned over and over that it's fat soluble, so it does take a little bit of time to make sure that we're absorbing that. And so you may not see that levels, immediately increase like you would a vitamin B.
Hmm.
So I normally wait about like 3 to 6 months before retesting.
Yep.
With that, we want to make sure we are absorbing it because there's a lot of absorption issues. So if there is, say, that you have, like we mentioned, it's fat soluble, and we need like bile salts coming from our liver and being stored in our gallbladder.
Yeah.
There can be other like gut dysfunctions, we'll say, where if you have the autoimmune condition of Crohn's or diverticulitis, if there's
Hmm. Hmm.
overgrowth in the gut, in the small intestine, it can be a really difficult time to absorb vitamin D. So this is where we want to peel back the layers and understand, okay, we're supplementing with vitamin D. Why in the world are we not increasing when I retested in 3 months? So we
Hmm.
want to get a little bit deeper. And of course, there are some like medications, even if they're short term or long term medications, that again, your prescribing provider can discuss with you as well. But the most common ones are steroids and statins and diuretics, and laxatives. So we just want to make sure and collect all of that information if you are supplementing or trying to get through food or UV lamp exposure. That's one I love too.
Right.
So yeah, just connecting all of those dots.
Absolutely. Absolutely.
Yeah.
Yeah. And then that's why I refer over to her pretty often, right? If
Thanks.
it's like, you know what, hey, we did the basics, we're doing the supplementation, you still don't feel like your baseline of symptoms are changing, there
Right.
might be more barriers that have to be removed. I'm not going to be your guru for that. She's going to be your guru. She's going to work really well hand in hand with your primary provider and put together a plan to get this better. And I think the one point of emphasis that I just maybe want to hammer home that
Yeah.
you said in there is this is a slow mover. It's slow to move into deficiency,
Mm-hmm.
and therefore it's slow to move back to normal. So if you've been working hard on it for even 12 months
Yeah.
and you've like, I worked my tail off for 12 months and I went up like, what, 15 points? You
Right.
might hang your head and be like, I only went up 15 points. It's like, no, that's actually pretty good
Yeah.
for
Yeah.
like working as hard as you've worked on it. So
Mm-hmm.
it just be patient with the process on this one,
Yeah. Yes.
especially.
It can be frustrating, but yeah,
Yeah.
we just have to hone into that patience.
Yeah, yeah, but every step in the right direction is going to be of benefit, and
Yes.
hopefully, in time, you're going to see those symptoms start to and continue to improve. And on a final note, like we were kind of saying, if we're starting to treat, and then we see that, like, okay, we're treating like these muscle pains, these joint
Mm-hmm.
pains, these neurological symptoms, and the patient isn't getting better, and then we refer out, the door kind of swings back the other way where Dr. Maggie, like I think you and I discussed, you might be working with somebody, it's like, these vitamin D levels are great,
Mm-hmm.
your overall musculoskeletal symptoms seem to be like a lot better, but like you still maybe have like this neck
Right.
type pain and everything. Well, that's either where she'll take care of it, or if it feels like it really needs next high level like rehab work and Mackenzie method type exercises and a bit more of kind of like the specialty that we have here. Well, then that's where we'll take it and we'll push it the rest of the way across the finish line, because
Yeah.
at that point it probably is a true
Yeah.
musculoskeletal pain
Yep.
that goes right in the wheelhouse of what us DCs love treating the most.
Yes, absolutely. It's
Yeah,
all about collaboration and integrative that care.
100%.
Yeah.
I think that was actually a pretty good take on everything. We covered a lot of stuff and
Yeah.
everything here too, but I love kind of the broad overview that we did in vitamin D. I don't know about you guys out there, but I learned a little something just
Same.
talking with Dr. Maggie, and that's why I enjoy trying to work with her,
Mhm.
enjoy trying to point more of our patients in that direction to get
Yeah.
the proper support underneath that they really need, because sometimes it's not just all a musculoskeletal problem, right?
Yep, exactly.
Yeah, yeah. So, from the macros and micros, this is our first episode. We're really excited to
Yeah.
be teaming up for the first time here. But I'm Dr. Emery Pitcel of Rothrock Chiropractic Rehabilitation. The contact info is in the description here below. But if you really liked this video, please drop a comment, hit a
Yeah.
like on the page here, subscribe, because
Yeah.
we're going to be, I hope, doing this
Yeah.
monthly for time to come and everything. And we're going to go over more than just vitamin D with you all out there. So,
Yeah.
Dr. Emery of Rothrock Chiropractic.
And Dr. Maggie Sopic of Recenter Chiropractic and Functional Medicine.
All right, thank you so much, and you'll get through February. Don't
Yeah.
worry. Keep your
Yes.
head up. Keep your hopes high. Spring is not that far away, everybody.
Yes, we are there.
Thank you so much for tuning in. We will talk to you guys all next time.
See ya.